Department of Health urges vigilance, not panic, against Mpox. While the National Health Department said the status of Mpox virus was still under control in South Africa, it appealed to the public to be vigilant and present to the nearest health facility if they experience Mpox-like symptoms. Those with chronic conditions such as HIV, tuberculosis, and diabetes were also urged to adhere to treatment as per the instructions to keep their immunity stronger against other emergency diseases like Mpox. This comes after the World Health Organization on Wednesday declares Mpox a public health emergency of international concern (PHEIC) amid an upsurge of Mpox in the Democratic Republic of the Congo (DRC) and a growing number of countries in Africa that had never reported Mpox before. According to the Africa CDC, suspected cases across the continent were now well over 17,000. The World Health Organization said Mpox was considered to be the PHEIC with potential to spread further across countries in Africa and possibly outside the continent. South Africa has confirmed 24 positive cases, including 3 deaths. Health Department spokesperson Foster Mohale said the declaration of Mpox as PHEIC doesn't immediately change the current response efforts by the country. In fact, the situation remains under control for now based on the number of positive cases and epidemiological and surveillance data at our disposal. Commenting on the possible connection between the Mpox virus and HIV, he said, A number of positive cases are living with HIV, and we urge all people with chronic conditions like HIV, TB, diabetes, and adhere to treatment as per the instructions to keep their immunity stronger against other emerging diseases like Mpox. The announcement by both Africa CDC and World Health Organization means countries should work together, share data and best practices to respond to this outbreak. Dr. Tamsin Lovelock of Stellenbosch University Tygerberg Hospital Infectious Diseases Unit said the World Health Organization declaration was not reason to panic but should be seen as Mpox being made a health priority, meaning there would be more resources made available for diagnostics and management of Mpox cases. Mpox is caused by a virus. It is an infection. There is an antiviral agent available to treat it, and there is also a vaccine. Both of those are not easily available in South Africa, although the antiviral agent can be procured for patients who have severe disease. However, what's important to understand about Mpox is that most cases of disease will be quite mild and they won't require any specific treatment. It will just be supportive management of the lesions and pain relief. In some patients who might have other illnesses affecting their immune system, those patients may get much more severe diseases which needs that specific treatment, Lovelock said. The ruling by World Health Organization makes access to treatment and vaccine a lot easier, particularly for less well-resourced settings. We have an established way to diagnose, we have a treatment and a vaccine available. What we focused on in terms of research is exactly how it is transmitted. Knowing how it is transmitted and in what population groups, there is an increased risk to help us find these cases. You always want more treatment options, less expensive treatment options, so treatment is always a big focus on research, but at the moment what we want to gather is how it is spreading and how can we affect that spread and limit the number of cases, she added. On the other hand, Southern Africa is safe for travel following World Health Organization's declaration on Mpox DRC outbreak. The Southern African Tourism Service Association (SATSA) said it is deeply concerned by the inaccurate and misleading reporting surrounding the outbreak of Mpox. This followed the World Health Organization's recent declaration, which classified the rise of Mpox cases in the Democratic Republic of Congo DRC as a public health emergency and international concern, PHEIC. The Voice of Inbound Tourism in South Africa said that while it fully supports efforts to combat the spread of Mpox and recognizes the seriousness of its declaration, Southern Africa remains a safe and desirable travel destination as tour operators in the region are committed to the highest safety standards and are working closely with local authorities to monitor the situation. David Frost, CEO of SATSA, said that though the tourism body recognizes the need for international cooperation to address the outbreak effectively, media narratives that generalize and stigmatize the entire continent do not contribute to resolving the crisis. It is critical to understand that Africa is not a country, but a vast continent, geographically larger than China, the US, and Europe combined. Each of 54 countries has unique environments and health contexts. Painting the entire continent as a high-risk zone due to a localized outbreak is not only factually wrong, it is damaging the crucial tourism economies across Africa, said Frost. While the World Health Organization's declaration highlighted the need for global vigilance, the risk to travelers in Southern Africa engaging in standard tourism activities is minimal and there is no need to cancel or alter travel plans to Southern Africa at this time. SATSA also urged media outlets to provide accurate, contextualized, and responsible reportings that avoid harmful generalizations. We support World Health Organization's efforts and remain committed to ensuring that travelers to Southern Africa have a safe and memorable experience. We advise staying informed through reliable sources such as the World Health Organization and the Africa Centers of Disease Control and Prevention, Africa CDC, said SATSA. In the meantime, SA Tourism notes World Health Organization classifying Mpox cases in DRC as public health concern. The South African Tourism Services Associated, SATSA, has acknowledged the World Health Organization's recent declaration classifying the rise in monkeypox, Mpox, cases in the Democratic Republic of Congo DRC as a public health emergency of international concern. The organization, which represents over 1,100 inbound tourism products across Southern Africa, yesterday said it fully supported efforts to combat the spread of Mpox and recognizes the seriousness of this declaration. SATSA CEO David Frost said they were deeply concerned by the inaccurate and misleading reporting surrounding the outbreak. Frost said they recognize the need for international cooperation to address the outbreak effectively. However, media narratives that generalize and stigmatize the entire continent do not contribute to resolving the crisis, Frost said. It is crucial to understand that Africa is not a country, but a vast continent geographically larger than China, the US, and Europe combined. Each of its 54 countries has unique environments and health contexts, he said. Frost said painting the entire continent as a high-risk zone due to localized outbreaks was not only factually incorrect, it is damaging the crucial tourism economies across Africa. The organization said South Africa remained a safe and desirable travel destination. It said tour operators in the region were committed to the highest safety standards and were working closely with local authorities to monitor the situation. It said this unnecessary fear-mongering was counterproductive. SATSA urges media outlets to provide accurate, contextualized, and responsible reportings that avoids harmful generalizations. The risk of travelers in unaffected areas remains low, it said. While the World Health Organization's declarations highlights the need for global vigilance, the risk to travelers in Southern Africa engaging in standard tourism activities is minimal. There is no need to cancel or alter travel plans to Southern Africa at this time, it pointed out. SATSA said it supported the World Health Organization's efforts and remained committed to ensuring that travelers to Southern Africa have a safe and memorable experience. We advise staying informed through reliable sources such as the World Health Organization and the Africa Centers for Disease Control and Prevention, AFRICDC. Earlier this week, Professor Elmarise Labert of the Tourism Research and Economics, Environs and Society TREES Research Unit at Northwest University, NWU, said Africa was in the best possible position to benefit from post-pandemic travel. In terms of tourism, the continent has grown significantly post-COVID-19, and according to the United Nations Tourism Report 2024, the continent has achieved a 96% recovery, which is driven by European markets, Slabert said. She added there was something to be said about the hospitality of Africans, the vast landscapes to escape to, the bucket list drive, the special places to visit, and above all, the unique and authentic experiences that this is Africa. This continent has also opened its doors wide to tourists after realizing the devastating effect of the absence of tourists. Priorities post-COVID such as air connectivity, digitization, investment, and ease of access have contributed to this growth, Slabert said. And that's it from INJIBS Africa. Stay tuned to the USA and political updates.